Cardiac stress test is traditionally called treadmill or exercise stress test. It is usually to evaluate the workload of your heart. And traditionally in the United States, a stress test is performed on a treadmill. Occasionally it is done in the bicycle, especially in the European countries. And for people who cannot exercise, they can do something called pharmacological stress test. That means they can insert an IV or an intravenous line in the arm and give you a medication which can increase your heart rate or also increase blood flow to your heart muscle. And usually a stress test checks your heart rate and blood pressure and the workload. Once a patient can exercise more than 9 minutes, we consider the patient is in a good heart healthy condition. However, if the patient cannot exercise significantly, either because of a physical condition, because of arthritis or other conditions, they do pharmacological stress tests. Normally, usually you do a treadmill testing along with imaging, either by echocardiogram, we call it stress echocardiogram, where we put a little gel on the chest and image your heart and take a picture before and after the exercise. Or you can do something called a nuclear stress test, where we inject something in the IV called isotope, which will take a picture of the heart and evaluate if there is any blood flow discrepancy at rest and post-exercise. And a cardiac stress test is a very important test to look at blood flow abnormalities to the heart, and it also gives you a suggestion that if you have a significant blocked artery. I am Dr. Ramesh Gowda, one of the board certified cardiologists at Mount Sinai Doctors, Brooklyn. You can see myself or one of my colleagues who can help you understand more and schedule you for a cardiac stress test and see whether you are at risk of significant heart disease.